It's Alex Howard, our Washington correspondent here at the Government 2.0 Expo here in Washington, D.C. We've had a succession of great interviews today, but I'm really excited about this next one for a number of reasons. It's Todd Park. He's the Chief Technology Officer, I was going to say CTO, of Health and Human Services, so HHS CTO. And you've been involved now in a number of fairly innovative ways of using open data in government. First of all, can you tell me where you're coming from beforehand and what you found so far at HHS?
Sure. Yeah, I just joined HHS at the end of August of last year, and I had not been involved in government at any level in my previous life. I'm a private sector entrepreneur by background in the field of healthcare and IT and data. But the administration has created this job called CTO of HHS. Which they called me about and were very persuasive in recruiting me for, despite my wife's desire to stay in California and focus on family for a while. And the nature of this job is very interesting. It's basically an entrepreneur in residence, internal change agent at HHS. It has no line responsibility. It's focused entirely on how HHS can leverage the power of data, technology, and innovation to improve the health of the country. And so I get to start and lead projects to do that and pursue issues that can help, if resolved, advance the ball in terms of use of data technology to improve health. And it's been an unbelievable experience. One of the things actually I tell my entrepreneur buddies is that it feels identical, sort of day to day, in most ways, to my private sector entrepreneurial work. It's still being an entrepreneur. It's still, recruiting fantastic people for, in this case, internal government startups to do really cool things incredibly rapidly and working incredibly hard. It's in a slightly different context,
Yep.
but the modus operandi still, feels very much the same. The other thing actually I've noticed is that if I took the best people I'm working with in the public sector and the best people I work with in the private sector and put them all in a room together and challenge you to come and tell me the difference, you couldn't tell.
Interesting. Okay.
I mean, they're all equally idealistic, equally pragmatic and results-oriented, very, very smart, work incredibly hard, very energetic, very mission-oriented, and just a ton of fun to be with. So I'm having a blast.
So you've been there since August. What are the projects you've gotten started on?
There's an array of different projects in the realm of health IT. I've been helping David Blumenthal and team with the nationwide Health Information Network, focusing in particular on a project, getting going a project called a NIN Direct, which is a lightweight on-ramp, if you will, to the NIN. The NIN was previously constructed in a very solid way as a way for large-scale organizations that may represent a lot of different providers to interconnect with each other, but that kind of NIN onboarding option was not necessarily conducive to smaller providers getting on to do things which may be less intense than what, say, Kaiser wants to do with the VA. So in addition to continue to support the Kaiser VA type interaction, NIN Direct is a new option that allows essentially lighter weight interactions that don't require as much kind of trust and technical layering in terms of stacks of stuff you have to do, and allows smaller providers who are actually happy to do less in a simpler way to get on board the NIN alongside the Kaisers and the VAs and the DoDs, etc. And it's an effort about which people like the VA are very enthusiastic, because from their standpoint, the more the merrier, and let's get everyone we can on board the network in whatever way that we can, and really get health interchange going. So that's one project. Another project actually is open government. So I'm actually co-leading the open government campaign at HHS.
Okay.
So as you know, the administration issued an open government directive calling every agency to figure out how to become more open, defined as being more transparent, more participatory, more collaborative. And so HHS has gotten very excited about this. We put together an open government plan.
So hhs.gov, people love this.
hhs.gov/open.
Yep.
Yeah. And we're pushing ahead aggressively now in implementation. And at the core of this plan, the element that I'm particularly excied about is open data. Is the whole notion of taking this ridiculously awesome array of data that HHS has on all aspects of health and healthcare, and obviously respecting privacy and confidentiality, so sort of liberating that data so that it can actually be turned into useful applications and products and services and insights that can help improve health. And so a great example of that is the Community Health and Data Initiative, which we'll be talking more about today. But this is actually a really interesting experiment that we started with Tim O'Reilly's help earlier this year. And we pulled together this small meeting on March 11th with Institute of Medicine, like 40, 45 people, and basically brainstormed about the notion of leveraging HHS's data on community health to help improve community health. And so what I'm talking about here is national, state, regional, county level data on smoking, obesity, utilization of healthcare services, access to green food, et cetera. And the question was, is that data useful? Does anybody want it? Can we turn it into really cool stuff that might help people? And the group of people we brought together was a very interesting, eclectic group that consisted, basically one half people who were healthcare experts, who just knew healthcare cold, and the other half were people like Tim, right, who had never been to a healthcare meeting ever, right, but who are masters at how you take data and change people's lives with it. And so you had, the healthcare people and the O'Reilly people, O'Reilly S people basically integrate. And they concluded that yes, this data was incredibly helpful, and B, they came up with 20 ideas that you could do now to build apps that would actually make it really useful to people and help change lives. And then even better, they volunteered to go build a bunch of them, and they recruited other people to help. So we're having a big Lollapalooza next week, June 2nd. This time with 400 people and webcasts at the Institute of Medicine, where 20 odd applications that have been built or improved using the data will be demonstrated. In a big showcase hosted by the secretary.
Yeah, I'll be there.
And you'll be there. Yeah. And the point is actually just to give people a glimpse into what people could do with even just 90 days of work with existing data, and make announcements that we're going to actually put even more data out there. It's even more accessible, machine readable, exposed as web service, ever expanding, and hopefully encourage more and more people to basically take that data and turn to ever cooler stuff. The analogy that I actually use is NOAA.
Yep.
So I didn't know this, before I joined the government, but there's this agency called the National Oceanic and Atmospheric Administration, right?
Yep.
That supplies like 98% of all weather data.
Sure, you go to weather.com, it's their data.
It's their data, right? And the local newscaster didn't measure barometric pressure himself, right? He got it from NOAA, right?
Geez.
But NOAA didn't do the newscast. NOAA didn't build weather.com. NOAA doesn't run the Weather Channel, right? NOAA doesn't print the sheet of paper in your hotel room that says it's going to rain tomorrow, right? I mean, that's done by other people, right? So they just supply a high-quality stream of a ton of data that's free and easily accessible and without intellectual property constraint. So I want to position HHS to be the NOAA of community health data, right? And I'd love for it to be the case that, in 5 years, right, community health data is ubiquitous, and shows up in lots of different places, ways large and small, that are helpful in much the same way that weather data or financial data or, other kinds of data have an ecosystem of use today. It generates a lot of public benefit.
So, I mean, you touched on it. There's probably no other area of electronic data where privacy and security are as important as HIT. There's nothing like the thorny issues, and it's heavily regulated too.
Yes, that's right.
Which actually your agency is
responsible for doing.
Focused on doing.
Yes.
So the technological challenges here aren't minor.
That's right.
How are you approaching bringing that? Of course, we can hear the technological challenges around us as they break down the Expo a little bit. So to the audience, hope you don't mind the banging and clanging. We're safe here. So please, so what are how are you approaching
those challenges?
How approaching those challenges?
Yeah. So those are incredibly important and serious challenges, which have to be addressed as a fundamental prerequisite for releasing data. So one of the reasons we're actually starting with community health data is that national, state, regional, and county level data is much more straightforward to actually release in ways that don't compromise privacy and confidentiality. Even there you have to be careful, right? Because if you put something out there that's county level, even regional level, right, but is on something that's a really rare disease or a service utilized very rarely, right, that becomes a problem, right? But something like diabetes, right, that's probably okay, right? Rate of diabetes or rate of smoking, so on and so on. There are other aspects of our Open Gov plan that release data, that will release data in the future, where we're having to go through a much more elaborate process to ensure that the data cannot be utilized in a way that violates privacy and confidentiality. And of course the key there, as you know, is not, you can't just strip the personal identifiers off the data, right? No. You have to actually account for the fact that the data could be mashed up with other data to actually re-identify somebody, right? And there are frankly data sets where realistically, you really can't make them freely downloadable by the public with no preconditions, right? I mean, there are data sets that you just have to have people sign an agreement that says, I promise not to do anything horrible with this, and you have a way to basically get them if they do something horrible with it.
Cool.
Because it's that sensitive. But even in those realms, there are ways to make that easier and harder for the right people to get. And we want to make it as easy as possible. We want to lower the barriers, but not do so in a way that ever compromises privacy and confidentiality.
So I should let you go. You've got your keynote coming up at 2:55, so we've got about a half an hour to get you over there and
Fantastic.
get ready.
I will go do that.
Thank you for stopping by to talk.
Thank you.